Welcome. My name is Peter Strong. I am a professional psychotherapist specializing in mindfulness therapy, which I offer online for healing anxiety and depression without the use of medications. Many people have tried medications, but find that they don't really seem to address the underlying cause of their anxiety or depression. Medications are not really designed to treat the cause of anxiety or depression. They simply treat the symptoms. And simply treating symptoms is not really sufficient. We need to get to the root cause of your anxiety or depression or other emotional, psychological problems that you may be experiencing. And that's the focus of mindfulness therapy. During these Skype therapy sessions that I offer, I will be teaching you how to apply mindfulness to work with your anxiety and depression more effectively. The real thing to understand here is that anxiety and depression are really the product of habits. Psychological habits that operate unconsciously without our choice. We simply become slaves to psychological habits. And the accumulation of these psychological habits creates sustained anxiety or depression. So the first function of mindfulness training and therapy is really to uncover these reactive, conditioned habits so that you can see much more clearly what triggers these habits and how the habits work, and then to develop a conscious relationship with these habits, because that consciousness is what gives you the ability to break free from reactive unconscious habits. Consciousness is vital for real psychotherapy, for effective change. So uncovering the habits, that's the first part of mindfulness therapy that I will teach you how to do during our online therapy sessions together. The second part of mindfulness therapy is very much concerned with looking at how to change the structure of those habits, how to basically bring about their healing, to heal the underlying fear that fuels the psychological habits. Fear is by far the most important core emotion that drives most of our anxiety, depression, and problems with emotional trauma, and also with intrusive thoughts. Fear is the real issue here. It provides a fuel source, if you like, that sustains anxiety and depression. So we need to work with that fear. One of the most important ways we can bring about healing and help heal that inner fear is by building a conscious and non-reactive relationship with that fear itself. So we call this developing the true self, little self alliance. Your true self is really that which is not the contents of your mind. It's like a parent. The parent is much bigger and less reactive than the child. The child is the little self. It's these accumulated habits. So when we develop this relationship internally between your true self and the little self, that sets the right conditions for healing, because the true self, which really is simply that which observes, that which can see the little self. The true self does not react. It is free from reactivity, and so it does not feed the anxiety or depression. Reactivity is the issue here, because that feeds the anxiety or depression or other psychological problems. So we have to overcome this reactivity. Reactivity is typically habitual and blind, and through mindfulness training we overcome that habitual blind aspect of the habit. So building this internal alignment is very important. The true self is able to bring a much bigger perspective to the habit, the little self. It's able to allow that little self to heal instead of feeding it through reactivity. It can also interact with the little self, with the habit, in creative ways that help that habit heal faster than it would by itself. So one way we do this is by working with the imagery of the emotion, the fear, that's fueling the suffering in the mind. We look at the imagery of it. How do we see it in the mind? Where is it located? Can we find a position where we can see it? Often the emotion is located in the chest or heart area or throat or stomach, or sometimes simply in the head itself. Its position is very much a part of the cause of the emotion. Its position is very important. It's part of the imagery that holds that emotion together. So changing the position of an emotion is one way that the emotion will start to heal. When you change its position, it will facilitate healing, especially if you do it mindfully, which means that you explore the details of where it wants to move to, what makes it feel better. A classic example of this is when you take fear, which is often located in the chest or throat area, as I say, and put it in a different position where it can feel comfort from you, such as putting it on your lap or holding it in your hands. If you can actually hold the fear, you will be building that alliance between the fear and your true self. Remember, the true self is fearless by nature, rather like a parent. When that bond is strong between your true self and the little self, the fear begins to heal quite quickly. The stronger it is, the faster it heals. So mindfulness training and mindfulness therapy is all about developing this internal relationship that speeds up the healing of anxiety and depression. And we do this by meditating on our emotions. Instead of just talking about them, which will do very little to heal them, instead of medicating them, which will do nothing to heal them, instead of reacting to them with avoidance or aversion, or trying to distract the mind from the experience of anxiety or depression, which will do nothing to help them heal, we instead turn our conscious awareness towards them. But we learn to sit with them and strengthen our ability to sit with our emotions without reacting. As we get stronger, we strengthen that bond, and that facilitates healing. There are many other ways we can interact with the imagery of the emotion. Besides changing its position, we can also work on changing its color. For example, depression has the color black, typically. Anger, probably red. Anxiety, very often orange or a bright color. Sadness, maybe grey or green or some color like that we discover by meditating on the emotion. The color is a very important part of its structure. That's what makes the emotion work. If we change the color, if we discover the best color for the emotion, where it feels better, then that will help it heal. When emotions heal, they do so by changing their imagery. In meditation work with mindfulness, we are doing this consciously, and so we speed up the healing process. So if you'd like to learn more about how to heal anxiety and depression without using medications and without years of talk therapy or psychoanalysis, then I encourage you to visit my website, and please feel free to contact me. Send me an email and tell me more about your particular situation. Ask any questions you have, and please consider scheduling a Skype therapy session with me. People really enjoy Skype therapy. It's so much more comfortable than conventional psychotherapy. It is not clinical at all in nature. It's much more inspiring and positive, I would say, than typical clinical psychotherapy. The mindfulness approach is very popular because it teaches you very practical ways of working with your emotions. So if you'd like to learn more and you'd like to schedule Skype therapy sessions with me, please go to my website and contact me, and then we can get started. Thank you.